Hi there folks, Michael from First Aid Oz once again, and we're looking at choking. Now choking obviously is an obstruction of the airway, so it can often be food, eating something too quickly or drinking something too quickly, or an object that you've stuck in your mouth. With little children in particular, often they'll pick things up off the floor, they'll put it straight in their mouth regardless of whether it's food or not. It could possibly be even dentures, mouthguard, those type of things, but more commonly probably food. Alright, so in the case of choking, what often happens is the person will cough, okay? They'll cough to try and clear the object. That's the body's normal thing, to try and clear a blockage. But the coughing process requires some air still to be getting through. Okay, so if the person is coughing, that's not a great sign that they've got a blockage, but it's good that they're able to cough, because more often than not the coughing will eventually clear the object. Okay, if they're coughing and the object doesn't clear, or they're coughing and then suddenly they stop coughing, they can't cough anymore because there's now maybe the object is embedded further, that's a more serious situation. Very important, if the person is coughing though, that we don't continue to give them anything by mouth. So don't give them more drink or more food thinking you might push the object further down or dislodge it, because sometimes that can be the difference between being able to cough and now no longer being able to cough. Once no air can get through the airways, the person's lips will start to turn blue, they'll start to become pale, and they will faint, they will collapse, they can become unconscious. Because now we have lack of oxygen going to the brain, which is again potentially fatal. So before we get to that stage, however, allow them to cough. Okay, if the coughing doesn't seem to be working, I want to call 000. Okay, I don't want to wait too long. It's always better to have the paramedics or the ambulance arrive, and perhaps by the time they get there they may not be required, than it is to not call them and wait too long, and by the time they get there there's nothing they can do. Okay, so as a first aider, particularly in the workplace, but even I would be the same at home, I would call the ambulance earlier rather than later. So in the case where they've been coughing for a while and it's not really helping, or it's becoming more difficult to cough, or the coughing stop, I call 000 straight away. If I've got someone else, I instruct them to call them. Now, beyond that then, the recommended treatment is a combination of what we call back blows and chest thrusts. So using my mannequin here, bear in mind that this would be a person. So let's say it's a child or an adult. Now I'm demonstrating across my knee. If you can get them across your knee, that's fine. If not, it can be across the chair, across the edge of the bed, or if it's a lower table or something. But basically you want them angled. Okay, you don't want them upright. Okay, the idea is if they're upright, okay, and you're able to dislodge the object, it can resettle further down, okay, which is not going to help. So the idea of having them angled forwards is that if I'm able to dislodge the object manually, it can work its way loose, and it's easier to either cough out, fall out, vomit out, whatever the case might be. We just need to get it out of there so airflow can continue. Alright, so I take the heel of my hand, okay, between the shoulder blades, okay, and I want to strike in the direction that I want the object to come out. Okay, so not just straight down. So it's striking upwards, if you like. So using the heel of the hand, and there's 5. Okay, so it's 1 strike, 2 strike, 3 strike. I do that 5 times with considerable force. Okay, you're not going to cause injury. Okay, and it needs to be considerable to effectively shock the object loose. Okay, this is something that's embedded. If it wasn't embedded, it could easily have been coughed out. So the person hasn't been able to cough it out. So we need a fairly substantial amount of force. All right, so we've attempted 5 back blows. The object hasn't shaken loose and it hasn't come out. So they've still got the blockage in here. So we perform what we call chest thrusts. Now I get my hand behind the person's back, and the other hand using the heel again on the lower part of the sternum, and I compress. 1, 2, 3, 4, 5. Again, hopefully it causes a gasp type reflex because I'm effectively compressing the area, which creates a little bit of force, air force from that gasp to maybe assist the object become loose. And then the person once again would cough and the object hopefully would come out. Now, how many times I'll do that? Basically, I should have already called 000, the ambulance should be on the way, and I repeat that process pretty much until the ambulance gets there or until the object is embedded, the embedded object works its way loose and comes out and the person returns to normal breathing. All right, so it would be 5 back blows, 5 chest thrusts, repeat, repeat, repeat. The only time I would stop is if the person becomes unconscious and breathing stops. We have a different situation there. Now we have a situation where the person has to undergo CPR, and if you have available, defibrillation, because the two key triggers are unconscious casualty and not breathing. So that can be a consequence of a blockage which is not able to be cleared. Now, the obvious problem that you're going to have is that you've still got this object embedded in the airways. So when the person is unconscious, if we're able to dislodge the object as we would normally try and do in our doctor's ABCD, we do. If we can't see it or if we can't get to it, we don't do nothing. Okay, in that case, we can still do the CPR and defibrillation. Okay, the only thing it's going to compromise is if we have a breathing component that you may not get the air through. All right, so you can do CPR, you can attempt to breathe. If you find there's no inflation going on, you've got the option to do compressions only. Okay, compressions only is going to be better than doing nothing. And still, again, if you have defibrillation or defibrillator handy, you still go through that process. Watch our CPR video for more details on how to do that. So we won't run through them all now, but remember the triggers are unconscious casualty, not breathing. Now it's gone from a choking situation to a CPR situation because breathing has stopped, heart either has or will stop. If we do nothing, the person is dead effectively. All right, so that's for a grown child or an adult. So it might be a case, and probably more commonly with an infant. Okay, when babies are learning to eat or first eating, we become very conscious of them not choking on their food because they haven't developed that habit of how to chew and what to chew and how for long. And often choking is caused by swallowing food which is not chewed enough, so I need to support the baby's head, so I'll just support under the jaw like that. Okay, and I want to angle the baby downwards. You see some people, hang the baby from their feet, probably a little bit extreme. But again, angle forwards. This time I don't use the heel of my hand, I use my fingers. Still a considerable amount of force for the baby, but not the same amount of force as the adult. Okay, not dissimilar to when you do CPR, you're using 2 fingers as opposed to 2 hands, but you're getting the same degree of compression, okay, but doesn't require as much force. So I'm using the tips of my fingers, and it wants to be in that direction again. So it's 1, 2, 3, 4, 5. Okay, if the object doesn't embed, doesn't shake loose, same thing with the chest thrust. Okay, now I can use my heels. I don't press as hard. Okay, 1, 2, 3, 4, 5. And again, I'm trying to get that gasp reflex where they cough the object out. Again, if the baby becomes limp, if they start to the head becomes floppy and they clearly looks like they've stopped breathing, this becomes a situation again where we need to do CPR and defibrillation if you've got a defibrillator available. All right, so choking is a very serious condition. More often than not, you're able to dislodge the object with coughing. Where coughing is not helping, call 000, 5 chest thrusts, 5 back blows, 5 chest thrusts. You keep repeating that until either the object clears and breathing returns, or until the paramedics get there and they will take over. Okay, so that's choking.